Everyone, we're here to show you how to tape up if we're having thumb or wrist pain. Specifically, this is a taping for what we call a tenosynovitis. It's going to be pain at the wrist right at about this region, usually aggravated more by thumb extension. So extend that thumb back, thumb extension or abduction of the thumb. So how we're going to tape this, we're going to cut a piece of tape about this long, probably the length of the mid aspect of the thumb to about mid forearm. Now, with our tape, like any other taping, we're going to round out the edges of the tape. So we're going to use our little taping scissors to round out the edges. Now, we want it to fit on the thumb, so I'm also going to kind of taper the end of the tape to fit, so kind of shaped like a thumb at the end point of the tape. Now, put the scissors down nice and safe so we don't stab our dear intern here. We're going to have him put that thumb into an upright position. I'm going to peel the tape off, and I'm going to anchor the tape right to the mid-thumb joint, and we're just going to kind of lay it down, use the backing of our tape to rub on the tape to activate the adhesives. Now, I'm going to peel that tape back. I'm going to bring it about mid-forearm, and we're going to lay it down here, and I'm going to have the patient just roll their wrist down, and then we're going to smooth it out. Now, this is going to be a nice, what I call a facilitator piece of tape to help take some of the strain off these muscles and tendons that are extending and abducting that thumb. Now, I've already pre-cut this piece of tape. For this one, we're going to do it for inflammation at the wrist joint. So we're going to peel off that tape, we're going to send it back, we're going to put about a 100% stretch down to a 50% stretch, and then we're going to wrap it right over the inflamed area, and we're going to close it down on both ends, kind of like a wrist cuff. We're going to use our tape, backing of our tape to activate the adhesives, and here we are with a nice tape job for a tenosynovitis or wrist pain.